Hi everyone, today I want to start the series of breast cancer. So breast cancer is the most common cancer among Canadian women, and it's also the second leading cause of death from cancer among women. On average, 78 Canadian women will be diagnosed with breast cancer every day, and 15 Canadian women will die from it every day. Breast cancer is also seen among men, but is not as common as women. So if we want to look at the chance of developing breast cancer, 1 in 8 Canadian women might develop breast cancer during their lifetime. There are a long list of risk factors for breast cancer. First of all, on the top of the list is the personal history of breast cancer. That's why that when it's diagnosed in some of the women, they are recommended to do a kind of preventive and prophylactic total mastectomy to avoid recurrence of the cancer in these patients. Also, family history of breast cancer or other hormone-related cancer can be a risk factor. Dense breast is a risk factor because it makes a screening and mammography very difficult in order to diagnose any possible mass in the breast. Genetic and some gene mutation also might be involved. Some other reproductive features, for example, early menarche in an age younger than 11 years old, or late menopause after age 55. Also late pregnancy after age 30 years of old, or nulliparity. These also might increase the risk of breast cancer. Hormone replacement therapy, especially when patients use a combination of estrogen and progesterone, and also for a long term being on oral contraceptive, this also increase risk of breast cancer. Obesity, especially with a BMI over 31, is a risk factor. Regarding to the obesity, there are also research supporting that high fat diet and also poor blood sugar regulation, which we called it as a insulin resistance, also might be involved in the risk of breast cancer. Alcohol consumption, especially more than 1 drink per day, smoking or being exposed to smoke as a second-hand smokers, physical inactivity, especially in older women in postmenopausal age, might increase the risk of breast cancer. Vitamin D deficiency, stress, when patient is on huge stress and low social support, they also being involved in increased risk of breast cancer. Also, exposure to xenoestrogens, for example BPA or phthalates. These are some chemicals that find in, for example, plastic container or cosmetics. They also might increase the risk of breast cancer. So as you see, there is a long list of risk factors for breast cancer. This shows us that preventive approach and having a healthy lifestyle, having a healthy diet in terms of managing the weight and all the environmental conditions that are very important in terms of prevention of breast cancer. Another important thing for breast cancer that everybody should consider is the screening. Screening is usually done through mammography. Based on the guideline in Ontario, women between age 50 to 70 years old, they usually, with the average risk, they usually receive any 2-year mammography in order to do the screening for breast cancer. In women that they are higher risk, even in younger age, like 40 and even less than 40, they are eligible to do the mammography for screening. In women older than 7 years old, they usually discuss with their family doctor or primary care provider in order to decide if they need any screening like mammography or not. Today, based on the guidelines, they don't recommend the regular self-breast examination, and the idea behind that is that it might create some kind of false perception and increase more stress and anxiety in women rather than being more effective in terms of early detection of breast cancer.